Good morning, everyone. Wynn Brown here on Sunday, March 15th, with our Haywood Healthcare COVID-19 morning update. Have another update for you this afternoon as well. As of last night, we tested our sixth patient for the coronavirus. And I will tell you that to date, of the six that we have tested, we have no results back yet from the state or from LabCorp, which is our reference lab that we use. Very frustrating, especially on the state front, since some of those tests are now out up to 5 days right now. We just started using LabCorp as well 2 to 3 days ago. So hopefully today we will have some test results back and we can report those back to you as we try to be transparent with everything that's going on across the health system and what else we know is going on with this pandemic in general. I just want to let you know that, just to remind all staff to use our controlled entrances so that we can monitor who is coming in and out of our building. Also, I know many folks probably exit via a different exit, which is fine. Just make sure that no one is drafting in the open door that you walk out of into the hospital. We need to come through our controlled entrances. I want to thank all the staff who have stepped up to man our entrances 24/7. That's extremely important and will become more important as the pandemic escalates in our region. So thank you for doing that. We are going to put a hold on the Haywood Hospital sign-up Genie app after Tuesday. So right now we need to re-look at how we're running that and staffing that. And so it's a little clunky with Sign Up Genius. So we're going to work on that and we'll get back to you shortly after we meet in Incident Command tomorrow morning. On the Athol campus, Jamie Courier is coordinating the screening at the entrances, and so you can reach out directly to her if you work on the Athol campus to see how you can support her in making sure that we have full coverage. So thank you very much for that. I just want to thank all staff who continue to work very hard and professionally to keep our hospitals and practices operating right now. It's a very challenging time, and it changes by the hour as we get more information going on, and I think we'll have a lot more information this week as to how we're going to operate just like the rest of the hospitals in the Commonwealth. So I appreciate your flexibility. Paul Heffernan our VP of HR, came out this morning with some information just to make sure that if you are working on pandemic-related work, that we're keeping track of that in a separate account. Because in the end, when we get through all of this, there might be some state or federal support for the work we're doing, and we just need to be very good at keeping track of it right now. It's a housekeeping item, but better to do it on the front end than the back end. Again, Sunday morning, a number of you are at home with your families. It's going to be another nice day. I encourage you to get outside. I also encourage you to think about how you can support your friends and neighbors. Have you called your parents? Have you called your grandmother? Have you checked in on that elderly neighbor in your next door to you who probably is feeling rather lonely right now and cut off, and make sure that we take care of not only the patients and our colleagues inside the four walls of our organizations, but also looking out to our broader community to see how can we be supportive and make sure that as we're all in this together, that we do the best job we can. And I appreciate everything that everyone's doing as we continue our journey to be one of the best community-owned health systems in America. So thank you very much. I'll be back to you this afternoon. Have a good day.